Hi everyone. Okay, now what we're going to do today is look at ankle pain, and more specifically, we'll look at an ankle sprain because that's probably most typical and most common ankle painful condition for the ankle. Now, it's generally a sprain of the ankle where you fall, you twist your foot on the outside, rolls over. That's the most common, and you sprain the ligaments. Now, while we're at it, little anatomy and physiology lesson here. A sprain happens to your ligaments. Now, your ligaments join bone to bone. A strain is muscle or tendon. Now, a tendon, just so you know, joins bone to muscle. Okay, so a tendon or muscle strain, a tendon joins from the bone to the muscle, and a sprain happens with the ligaments, and ligaments join bone to bone. So when you twist your ankle, you are spraining your ligaments of your ankle, of which there are three ligaments on the outside, and they class them differently, grade 1, 2, and 3 sprains. Um, Now, so what I'm going to do in this lecture is teach you the acupressure points that we can use for this, and also the exercises, because it's fundamentally important that you, with any injury, you start to work the area as soon as possible. So that's what we're going to show. I'm going to show you the remedial exercises um, and what you need to do from day one. Okay, so speaking of day one, so you've got an ankle sprain. You'll have swelling, as you can see from the picture, maybe there's some bruising starts to come out. The first thing you do for the first 48 to 72 hours is, you can either say rice or price. The difference being price means, the P means for protect. So you're going to protect the area. Rice, R for rest, I for ice, C for compression, E for elevation. So let's just go into that a little more detail because this is important that you know what to do. So the first 48, so let's say you sprain your ankle today. The first 2 to 3 days, here's what you're going to do. You are going to ice it, which means no more than 15 minutes, bag of ice, frozen peas, that sort of thing on the affected area. Now, if it was an elderly person or a child, ice might be just a bit too much, too uncomfortable. You can use, instead of ice therapy, cold therapy, where you might have a bucket, a bowl, something like that, where you can put the foot into water with ice cubes. So, it's a little more comfortable for the person. Now, okay, so that's ice. So you're going to rest it, obviously. So you want to stay off it because you don't want to be running around and doing more damage to the ligaments. You're going to ice it to decrease the swelling. The other thing you're going to do to decrease the swelling is a compression bandage, and I'm going to go into that in a little more detail, how you do that. And lastly, elevate. Elevate the limb. Oh, sorry, just to go back, the compression bandage is also to decrease the swelling. And by the way, the compression bandage is not going to stop you re-injuring the area. And that's important that you know. The compression bandage is really just for swelling. So and just kind of to make you know that you've got an injury. So just because you've got a compression bandage on doesn't mean you can start just going out and running around. And so you still have to be very, very careful. It's more about the swelling and decreasing of the swelling. Elevation. E is for elevation. You want to lie down, get your foot above the level of your heart so that the fluid can then naturally drain down to take the fluid out of that ankle. All right, now let's just go into a little bit more about how to tape an ankle. So let's say you've sprained the ankle, or say one of your clients sprained their ankle. How do you tape it? All right, so let's get into how to tape a sprained ankle. So when it comes to putting a compression bandage on, as I said to you before, and it's important you know this, that the compression bandage is there to reduce the swelling. And it will make your ankle feel better because there's less pressure within the ankle. But just be aware that it's not there to protect your ankle from re-injuring it. So you just need to be very careful of this, okay? So, okay, what you do when you go to do a compression bandage on the ankle, you start at the ball of the foot. Now, if your bandage isn't already rolled up, make sure it is rolled up, and hold your ankle at around about 90 degrees. And start the bandage where your toes meet the body of your foot. And what you're going to do, you hold the loose end of the bandage at the side of your foot, and then wrap the bandage around the ball of your foot once, keeping it, pretty tight, with just a slight light pull. Now, after this, then you just slowly start circling your way around the arch of the foot, and then pull the bandage diagonally from the bottom of the toes across the foot's top and circle it around the ankle. Now, what you do is you bring the bandage diagonally across the top of the foot and under the arch in a figure 8 pattern. Okay, so basically what you're doing is a figure 8 pattern. Now, when you get to the ankle bone, just keep continuing around and in this figure 8, moving towards the heel and then up towards the calf at the top of the 8. All right, so you've got to keep going up, around, doing the figure 8 movement as you work up, around. You want to do the whole foot and then end the bandage, as you can see in this image, several inches above the ankle. Now, some of the bandages you'll get, they can actually stick onto themselves, which is fantastic. Others have little clasps that when you finish with the tape, you can clasp them on, the little those little sort of hooks. I can't remember what they're called, alligator hooks or something they're called. I can't remember now. Or just a little piece of tape. Okay. You want to have the wraps, pretty snug, but obviously, you don't want to cut the circulation off to the foot. So that's what you're going to do as far as the compression stage goes. All right. So you've iced it, then you put your compression bandage on, and you're obviously going to rest it, and then you'll put your TV on, put your foot up, and elevate it above the heart. Right, so what we want to do here is have a look at the points that we're going to be using to treat this ankle sprain. Now, or foot pain or ankle pain, you can use them for all, but as I say, we're just specifically looking at sprains, but it wouldn't matter. If you were just having any sort of ankle pain or foot pain, you could use exactly these same points. But as I say, we're just focusing on ankle sprains because it's the most common form of ankle pain. All right, now if you look at the diagram, directly behind, these are the points we're going to be using, and I'll show you how I stimulate them shortly. Directly behind the ankle, you will see UB, which stands for urinary bladder. It's the meridian of the bladder meridian. Number 60, it's the 60th point on the bladder meridian. That one we're going to be using, that is directly behind the ankle. So what you do, you look for the midpoint of the ankle when you're finding this point, and between that and the edge of the Achilles tendon, and it's halfway in between. So it drops into that hollow between the Achilles tendon and the midpoint of the ankle bone. This point is a great point for swollen feet, ankle pain, even thigh pain. It's great for arthritic conditions in the foot joints, and even lower back pain because the urinary bladder goes right along the back there. So it's a very good distal point for back pain. Now, urinary bladder 62, below the ankle, you see that, UB 62. This is another point. It's a thumb's width below the ankle there. So you find that the bottom point of the ankle, get your thumb, measure it, and you'll see me doing it. And this point here is just in a little hollow. You'll find a little dip, and that's exactly where it is. This point's great for any sort of heel pain, any sort of ankle pain. It's even good for insomnia. And for any sort of just generalized foot pain, this is a great point to be using. Now, if you look from urinary bladder 62, it's just faint in this image. You'll see GB40. That's the other point we're going to be using. It's a great point, again, for ankle pain. Now, this is GB, stands for gallbladder, gallbladder 40, and we will be using this point. And what you do, you just drop down sort of 45-degree angle and drop into, you'll see there's a big dip. And that is a great point to use for any sort of ankle sprains, toe cramps, and even sciatic pain. It's a fantastic point, and then we're going to be using that one as well. So the other points we're going to be using, as you'll see in this diagram, are kidney 3 and kidney 6. Now, it's really easy. This is on the inside of the ankle, and they're basically the opposite points to bladder 60 that you stimulated on the outside of the ankle. And it's exactly the same position, but on the inside. And you'll see when I go into the stimulation of these points, we use a pincer grip to stimulate both at the same time. Now, this point there, kidney 3, you just have to be careful. It's forbidden to be strongly stimulated after the 3rd month of pregnancy. So you don't want to be doing that if a person is after their 3rd month of pregnancy. And it's in the hollow, just midway between the inside of the ankle bone and the Achilles tendon. Same as before. It's a great point for swollen feet, for ankle pain, and the Chinese medicine, they say it's also a very good point for strengthening the ankle joint. The other point that you see there is kidney 6, just below the ankle bone. Same thing, 1 thumb width below the inside of the ankle bone. Again, it's the mirror image of basically what we did on the outside of the ankle, so it's very easy to find. And again, a really great point for swollen ankles, as well as any sort of just heel and general ankle pain. All right, so here we are starting to stimulate the points. Now you can see here, I'm down on that kidney 6 point there. As you say, 1 thumb width below the inside of the ankle there. 1 thumb width directly below the center point of the ankle. And there you see I'm on kidney 3. Okay, so where the ankle is, right between the tendon and the ankle. And now I'm using the pincer grip on kidney 6 and bladder 62 on the other side. We're going to show you the other side in a second. So here we are, bladder 60. Now you're going to stimulate each of these points for 1 minute. So I'm just using your thumb, your finger, you can do circles or just press down. And there we are there, bladder 62, dropping into that little dip there. So every point you're going to stimulate for 1 minute. And there we go down to gallbladder 40. So it just drops down into that point there. So every point, 1 minute is exactly what you want to do. You can see that, just using my finger there. Okay, I just want to speak about rehabilitating injuries because it's an important factor. Now, okay, using acupressure, you're going to use the acupressure that I've just showed you, say 3 to 4 times a day. You can use the acupressure, but you also need to use what's called controlled movement. And what that really is after the first 2 to 3 days with any injury, you want to start getting the affected joint moving. Now, when we talk about getting it moving, we talk about getting it moving pain-free. All right, so what we're going to do is carefully exercising the soft tissues using pain as your guide. All right, so what we're going to do is start to move the limb, the affected limb, and in this case the ankle. And you're going to use that, but use pain as your guide, as I say. So it's going to be pain-free range of movement. So this is what we're going to do. So after the first couple of days, what we're going to do, we're going to start to use movement, and I'm going to show you these movements in a second. Use these that do not produce nor increase your pain. What this is going to do is stimulate the healing process without causing any further damage. So after that, after say day 2, when we get to about day 4, day 5, then we're going to just slightly increase the movement to getting into a gentle stretch. So we're going to further increase, because what you really need to stimulate your healing process is more and more movement, pain-free, without increasing any pain, without producing any pain, but we're going to start to go from just gently moving it to moving it with a stretch, as you're about to see shortly. And then we're going to progress from there on. But so I just want to make sure that you know this. Doesn't matter what injury you have, it's important to get that joint moving pain-free as soon as possible. So as you can see here, what we're going to start to do is start to implement movement like I talked about. Up and down, You can do this several times a day, 4 or 5 times a day, just starting to work it in a pain-free range. Now we're in up and down and now in and out, okay? So you can see that 4 or 5 times, make sure it is pain-free. Do that for the next few days. Then, around about a week after the injury, what you're going to do the same movements as you can see here, but you're going to hold it for a pain-free, which I stress, stretch. So it's the same movements. So after a week, after the injury, you're now going to do up and down, in and out, but you're going to hold them for 3 seconds to get just a nice stretch that does not produce pain or increase any pain. Now, after a couple of weeks, what you can do then is just lean down on the tops of your feet there to get, again, a gentle, pain-free stretch. So this is after a couple of weeks now. Now, I would like to mention that don't attempt to run until you can walk on your tiptoes and hop several times without pain. Okay, so we're just gently increasing more stress. Now, what we're doing here, you can also start to just stretch out. What I've done, the right foot, you can't see it in frame here, but what I'm doing is stretching, keeping the heel on the ground, both feet parallel, and I'm just stretching out those tendons. The other thing which is vitally important is proprioception. Balance on one foot. 30 seconds. Once you can do it for 30 seconds, do it with your eyes closed. This will help your nerve endings and really help you. All right, so let's just go back through this. I just want to go back through this so you understand completely what we're doing with injury management. This just happens to be with a sprained ankle. All right, so the first thing you do, say you sprain your ankle, or one of your clients sprains your ankle. Now, obviously, if you feel that you're out of your depth, you're not sure whether it's a grade 1, 2, 3, and you can look on Google to see. I just don't want to complicate the course too much, but you can look at the grade 1, 2, and 3 different types of sprains. But generally, if it's really bad, most people won't come to see you as a massage therapist. But if someone does come to see you or you sprain your own ankle, here's what you want to do. Rest, ice, compression bandage, elevation, first couple of days, and then start introducing movement into that area, which is pain-free. And then after 4 or 5 days, you're going to start stretching it, doing a gentle pain-free stretch, starting to stretch the scar tissue, those ligaments, and just start to create a healing process that is ideal so that you're going to have a good wound that's going to be healing properly for you. So you're going to do that, and then, as I say, you're going to then sit on your feet, as I showed you, to just gently stretch that area once again, and which is vitally important. The final step is proprioception, and you can do that into the 2 to 3 weeks, as long as it's pain-free, as long as you can do it, and that will get you back up and walking. And there are further progressions. Obviously, if you're an athlete, you're going to have to start doing exercises where you, let's say you're a footballer, for example, and you have to dodge between people as a footballer. You would do those exercises between witches' hats, cones, as you do that to further stimulate healing and further challenge your ankle. But that's a lot deeper scope than we have here at the moment for this. So acupressure on those points 2 or 3, 4 times a day, and then implement these exercises, and you're going to be a world better much more quickly.